Sige. So, let's answer the following questions. Naa si Ma'am Eroy karon sa school. Nag-ingon to siya nga naa siya sa school. Okay? So, write the capital letter of your choice only. So, please follow instruction kasi remember that Schoology is very sensitive. So, basig mamalian ang inyong answer kung wala mo nag-follow instruction. So, in this question or set of questions, you just have to classify the given beta blockers, whether they are non-selective, cardioselective, antagonist with partial agonist activity, and antagonist of both beta and alpha receptors. So, kaning antagonist of both beta and alpha receptors, we also call them mixed acting beta blockers. So let's have the first one. What is your answer for propranolol? Sorry, propranolol. So do not forget, class, that propranolol is non-selective. So the answer here, class, should be letter A. Propranolol. If it's non-selective, then it is able to bind to both beta-1 and beta-2 receptors. Thus, you don't give propranolol to patients with asthma or COPD. And then, next, how about carvedilol? Brand name in the market is Carvid. So we have 6.25 milligrams and I guess it's 12.5 milligrams ang dose of carvedilol na available in the market. So carvedilol, since 'di ba, I told you na our hint here is isa siya sa mga hindi nag-end with the olol, and kung hindi siya nag-end sa olol, ano siya, mixed acting siya. Meron siyang activity on the alpha receptor. So that's correct, letter D. How about the pindolol? Pindolol is letter C. So this one is a beta blocker, but it has a partial agonist activity. So it may act as an agonist in the beta receptor. Thus, you cannot give this to patients with arrhythmia, ng mga conditions sa heart like arrhythmia. Next, the last one, we have metoprolol. Syempre, wala na tayo laing nabili din na choice. It's letter B. So, remember our mnemonics BIM. Some uses BAMA-ECB as mnemonics lang to remember our cardioselective. So, pag cardioselective class, do not forget, selective siya for beta-1 receptor only. So, wala na siya nag-bind sa beta-2. Next, the known adverse effect of the alpha-1, this should be antagonist. What was your answer? Agonist akong ibutang din. It should be antagonist. But sige, answer ninyo.
Orthostatic hypotension.
Orthostatic hypotension.
Ma'am, vasodilation.
Let me recheck that one ha, kasi my question is, nakalimot ko nga, it should be an antagonist. But if you have mistaken this as an antagonist, I actually expect your answer here as first dose syncope or first dose phenomenon. That's the problem talaga natin with the alpha-1 agonist. But let me recheck it. Anyway, mag-check man hinuon ko ani. Pero for alpha-1 antagonist na those drugs that end with zosyn, it should be first dose syncope or phenomenon. Antagonist din yung pagkabasa. It should be antagonist. Nalibat na ang nag-type. Anyway, in a separate sheet of paper, you have to complete the table and upload your answers. So let's start with our phentolamine. What's the mechanism of action of phentolamine, class? Again, what's the mechanism of action of phentolamine?
Bind with alpha-1 and alpha-2 reversibly, ma'am.
Okay. Yeah, it can bind to alpha-1 and alpha-2 receptors. But I need to see the word block. Taga-block.
Block the epinephrine and norepinephrine, ma'am.
Yeah, and
Compete, ma'am. Pwede yung word na compete.
yeah, pwede din compete, inhibit, block. I need that. Kasi if you just say nag-bind siya, agonist also binds sa receptor. Pero antagonist man gud ni siya. So let us be specific with the inhibition, the blocking, or competition with the epi and the nor-epi. Oh yeah,
Ang prevent, ma'am.
prevent the binding also.
Okay, ma'am.
Prevents binding. Oh.
Prevents the binding of the epi and the nor-epi. So what's the clinical application of phentolamine?
Ma'am, pwede yung ano.
I have no
Kasama.
other answers here. Pheochromocytoma.
Toma.
Yeah.
Ma'am, what if, ma'am, ang gilagay, ma'am, is patient with benign tumor that develops in adrenal medulla?
Oh, it's okay. It's okay. That refers to pheochromocytoma gihapon. So, walay problem. Pero, anyway, ang uban, pheochromocytoma, automatic, ano na siya. Correct. Correct po ito imuha blessing. Next, how about tamsulosin? What's the mechanism of action?
Selectively bind to alpha.
Echo. Yes, unsa ta? I want to see the
So, binding pa rin, ma'am.
yeah, but this one is specific, right? Tamsulosin is specific for alpha-1 receptor only. So I should see that sa inyong answer. The same keywords but specific siya for alpha-1 receptor. So what's the clinical application of tamsulosin? Asa ginagamit ang tamsulosin?
Relax na to small.
BPH, ma'am.
Okay, tama. BPH, benign prostatic hyperplasia. Kung na nag-answer of hypertension, I will also consider that. Next, carvedilol. What's the mechanism of action of carvedilol?
Bind selectively to alpha-1 receptor.
Yeah, you can answer that, but please take note that carvedilol is a mixed acting beta blocker. So I have to see both receptors there na ginablock niya, alpha and beta receptor. Wala siya kung dapat makita sa inyo mechanism of action. Bisag unsang pagka-state ninyo, I just want to see the blockade, inhibition, or competition sa alpha and beta receptor kasi mixed acting si carvedilol. So what's the clinical application of carvedilol?
Heart failure, ma'am. Heart failure.
Treatment for chronic heart failure.
Yeah, that's correct. Heart failure or chronic heart failure, hypertension na siya ang ginagamitan sa carvedilol. Any other answers? Wala na. Okay, so let's have prazosin. So prazosin class, mechanism of action is the same with tamsulosin. So I want to see the alpha-1 selectivity niya. Ha? Kay selective man si prazosin. Dili sila pareho ni phentolamine na both alpha-1 and alpha-2 receptors. And clinical application, the same thing with tamsulosin also. So, benign prostatic hyperplasia and hypertension. And how about euhimbin? What's the mechanism of action of euhimbin?
Alpha selective, agonist, antagonist.
Unsa na alpha?
Alpha-2.
Alpha 2.
Okay, very good.
Ay,
Alpha.
wala ko na.
So unlike tamsulosin and prazosin, euhimbin is for the alpha-2 receptor. Tama na siya, Belly. Blocks alpha-2 receptor. So what's the clinical application of euhimbin?
Orthostatic hypotension.
Okay, very good. Very good. You can use this as a treatment for orthostatic hypotension at the same time. You can answer erectile dysfunction sa mga lalaki. Ano lang. Questions, class, about this part? This is the last part for the quiz. Wala? Sige. Drugs for neurodegenerative diseases. So this will be our next lesson for midterms. Again, drugs for neurodegenerative diseases. So we will talk about the neurotransmissions of the different neurotransmitters in our body, especially in the central nervous system. And then we will talk about the pathophysiology of the different neurodegenerative diseases. And also, we will discuss the different drugs na pwedeng gamitin as treatment for those conditions. So especially their mechanism of action. So before that, let's talk about the synaptic potential. So this is how our neurotransmitters work. So either they follow the excitatory pathways. Tatlong klaseng synaptic potentials ang meron tayo. Excitatory pathways, inhibitory pathways, and the combined effects of both pathways. The EPSP is excitatory pathway synaptic potential, and ITSP is inhibitory pathway synaptic potential. So when you say excitatory pathways, class, from the word excitatory, this means there is stimulation, there is excitation of our neurons caused by the movement of the ions in our body. Okay? So again, if there is movement of the ion, when you say movement, it's in and out of the cell. If it is included in the excitatory pathway, that means the movement of the ion will lead to the excitation or stimulation of the neuron. So we call that depolarization of the postsynaptic membrane. So pag ma-excite na siya, it is actually caused by the depolarization. So how do we generate the excitatory na pathway of the synaptic potential? So first, we have here stimulation causes release of neurotransmitters causing transient release of sodium ion permeability. So sa excitatory pathways, naapod tayo ginatawag og mga excitatory neurotransmitters. So these are the neurotransmitters that will cause movement of the ion, especially the sodium ion, na magsulod siya inside sa cell. Nasulod siya sa cell plus kasi remember the magpiso ka, magnesium, potassium in, sodium, calcium out. So supposedly, sodium should be found outside the cell. But if there is the presence of these neurotransmitters like glutamate and acetylcholine, it will lead to the entrance of sodium papasok sa mga neurons natin. So, pag pumasok si sodium, or we call that influx of sodium, it will cause weak depolarization. The term there is depolarization. And when you say depolarization, it means that the inside of the cell becomes more positive. Kasi remember that sodium ion is a positively charged ion. So when it goes inside the cell, it will make the inside of the cell more positive. And again, we call it depolarization. So that depolarization class can increase the stimulatory, excitatory neurons. And then, mo na siyang ginatawag na karon og excitatory neurotransmitter release or action potential. So take note of the different neurotransmitters involved in the excitatory pathway. We have the glutamate, we have the acetylcholine, norepinephrine is also included here, dopamine is another one. And then what else? We have also epinephrine. It can also cause excitatory na action potential kasi it will lead to the depolarization of the cell. So do not forget that the ion involved here is the sodium ion. It will make the cell more positive. Now, Ang kabaliktaran naman is we have the inhibitory pathway. So the one na involved naman in the inhibitory pathway are the inhibitory neurons and syempre the inhibitory neurotransmitters. So when you stimulate these inhibitory neurons, it will cause movement of the ions that will now result to the hyperpolarization of your cell or your postsynaptic membrane. So, unsay kaibahan ni depo ug ni hypo? Si depo again, the cell becomes more positive, while the hyperpolarization, the cell becomes more negative. So, the inhibitory pathway is generated by the following na mga occurrence sa sulod sa cell. So, first, there will be stimulation of the inhibitory neurons, which causes the release of inhibitory neurotransmitters. So, these are examples, class, of inhibitory neurotransmitters. We have the GABA or the gamma aminobutyric acid. I guess na mention ko na siya last time when I discussed the different types of receptors. And then glycine is also an example. Though I believe you know that glycine is an amino acid, but inside the body it can act as neurotransmitter. And to be specific, ano siya, inhibitory neurotransmitter siya. Now once these neurotransmitters are released, this will cause either the entrance of chloride sa cell or the entrance of potassium sa cell. So, basig maglibog mo. Let me write sa screen. Kasi si chloride, automatic kasi yan siya. Pag pumasok si chloride sa cell, the cell will really become more negative because chloride is negatively charged. But how about potassium? Kasi di ba potassium is positively charged. Sa cell kasi class, kapag pumasok si potassium, lalabas si sodium. It's constant, yan talaga ang nangyayari sa cell. Therefore, pag pumasok si potassium, lalabas si sodium. Exchange yan silang dalawa. And the exchange takes place in this manner. Always ito siya class na dalawang potassium ang papasok but tatlong sodium ang lalabas. That makes it hyperpolarized or more negative. Kaya mas daghan ang positively charged na ion nagmigawas kaysa sa nisulod. So, we have may mnemonics tayo dito. Si Trina Antukin. Ito yung ginagamit natin for the board exam para ma-remember natin ang ratio ng sodium and potassium na magsulod o magawa sa atuang cell. So si Trina Antukin. Kasi 3 sodium in or out, depende kung asa sila padulong ha, and then 2 potassium ang magsulod. Okay? Questions? Questions so far? Ang potassium hakay mag-lead into hyperpolarization. So mo na siya, mahimo siya more negative ang cell, mo na nga na ay inhibition of the action potential or na ay decrease in the action potential. But actually in the body, this one, the overall action is the summation of the two. Meaning in the body, we have both EPSP and IPSP na nag-work. Okay? So, kailangan balance na silang duha. So questions about the pathways of the action potentials in the body? Wala. Pag na-activate ng action potential, meaning your cells are being activated also or stimulated. So that will be the time na buhi kayo ka. Unlike na pag you have a lot of GABA and then daghan nga chloride ang musulod sa cell, mo na nga ang mga drugs na naga-mimic sa action ni GABA is naga-cause oxidation kasi na-inhibit ang action potential. Okay? I hope that's clear. So let's move on sa mga neurodegenerative diseases natin. So when you say class from neurodegenerative, it is characterized by a gradual, a progressive loss of, selected neurons in discrete brain areas. And then kapag makulangan na tayo, there is death pag when you say loss of selected neurons, meaning uh, there is death of these neurons in discrete areas of our brain, and this will result to disorders, especially one sa movement, and then number 2, cognition. And there are also conditions na both movement and cognition will be affected. So, depende lang kung what part of the brain is being affected. Kung asa nga part sa brain ang naay loss of neurons. So what are these neurodegenerative diseases? So number 1, we have the Parkinson's disease, or we call it Parkinsonism. And then number 2, we have the Alzheimer's disease. Number 3, we have MS. MS means multiple sclerosis. And then number 4, we have the ALS, or the amyotrophic lateral sclerosis. So kaning si ALS, I think you have encountered this during the time nga nag-viral ang kanang mga bucket challenge, kanang magligo bitaw sila ice. So actually, ano na siya, murag campaign nila na i-donate para sa mga people with amyotrophic lateral sclerosis. So we'll get to know this for neurodegenerative diseases. So I believe you are familiar with Parkinson's disease. Most of the time, movement is affected for Parkinson's disease. And for Alzheimer's disease, we have the cognition. And for both MS and ALS, both movement and cognition may be affected. Questions, class? Wala. Buhi pa mo dira. Buhi pa na. O basig nag-degenerate na to ang neurons. Napatay na.
Buhi pa, ma'am.
Buhi pa. So again, pag neurodegenerative diseases class, nagakamatay ang mga neurons sa ato ang brain. So leading to this condition. So let's start with Parkinsonism or Parkinson's disease. This is class a progressive neurological disorder involving or na-affect sa muscle movement, and then unsa ang mahitabo sa muscle movement, there will be tremors, there will be shaking, there will be muscle rigidity. Wala, if you can see a person with Parkinson's disease, murag gahi kaayo ang ilahang mga muscles, ilahang lawas, like dili gani sila kaduko because stiff ang ilahang mga muscles. And there is bradykinesia. Diba, brady means slow, just like bradycardia, there is slow heart rate. So when you say bradykinesia, brady means slow, and then kinesia is movement. So when you hear the word bradykinesia, it refers to the slowness in initiating and carrying out voluntary movements. And then there will be postural and gait abnormalities. So sa gait, it refers to the pattern sa paglakaw or pagwalk sa atuang patient. So magkaroon po, syempre kasi na ay effect on the muscle, then ang paglakaw po will be affected. That's Parkinson's disease or Parkinsonism. So most cases of the Parkinson's disease involve people over 65 and above. Pero class, there are really people na early ang onset sa ilahang Parkinson's disease. So mostly mga 40 years old, ang uban below 40, nag-manifest na ang ilahang mga signs and symptoms sa Parkinsonism. So our incidence for Parkinsonism is 1 in every 100 individuals. So 1% of the population nato sa whole world na ay Parkinson's disease. Okay? Questions? Wala? Now let's talk about the etiology of the disease. When you say etiology, asa gikan, unsay hinungdan sa Parkinson's disease. So since this is a neurodegenerative disease, it means there is a type of neuron in a discrete area sa brain ang nagkaroon og death, nabawasan. So actually, ang Parkinson's disease is related with the destruction of the dopaminergic neurons sa brain. So natay certain nerve cells or neurons in the brain that is dopaminergic, meaning naga-release og dopamine. And we call it substantia nigra. Again, the part of the brain that contains this dopaminergic neuron is called the substantia nigra. Now, if there is destruction, there is death of this kind of neuron, then the consequence will be there is also decrease in the number of dopamine or level of dopamine. Syempre, included na ang iyang action, mag-decrease na siya dito sa corpus striatum or the neos striatum of our brain also. So these are parts of the basal ganglia system that are involved in motor control. So ano ni siya class? Dopamine will be released in the substantia nigra. Now once released, dopamine will take its action in the neos striatum, and this is the part of the brain na nagakontrol sa atuang movement. That is why when you have Parkinson's disease, movement is affected. So when you look at the brain, if we cut the brain, midsection ha, midbrain ito. Kasi this is where we can see the substantia nigra. So kung ihati na to like this one, you can see the substantia nigra at the center. It is literally called nigra because it's a black portion in our brain. This is where we see the cells that release dopamine. Now, if we will look at the brain of a person with Parkinson's disease, look at its substantia nigra. Actually, there will be diminished substantia nigra. Wala tong color black, meaning namatay na ang mga cells dinhang dapita. Okay? Questions? Wala. Nasabtan ang Parkinson's disease? Yeah, substansya na lang nabilin. Wala na yung nigra kasi mawala ang black portion due to the death of those neurons. Pero class, please take note that aside from having Parkinson's disease, we also have the so-called secondary Parkinsonism or pseudo-Parkinsonism. So itong condition na ito, the person does not really have a real Parkinson's disease. Pseudo means false. Nagkaroon lang siya ng signs and symptoms of the Parkinson's disease because of secondary na mga causes, just like the effect of certain drugs. So examples of drugs that will cause pseudo-Parkinsonisms are those drugs that block dopamine receptors in the brain. So we have here the phenothiazine and the haloperidol. And let me inform you that these two drugs are antipsychotics or antipsychotic drugs. Diba, remember class that that dopamine should be maintained in normal level. Once we have a lot of dopamine, it will lead to psychosis. And if we have low dopamine, it will lead to Parkinson's disease. Now, people with psychosis will be given drugs that will inhibit dopamine. So, mo ni siya mga haloperidol, phenothiazine, and other pa na mga antipsychotic drugs. And since they will inhibit the action of dopamine, it will lead to adverse reactions like pseudo-Parkinsonism. Therefore, ang mga people with psychosis taking this kind of drug, na sila yung mga signs and symptoms of Parkinson's disease. Not because they really have that kind of disease, but because of their drug. Okay? So, let's talk about, if you don't have questions, you may send your questions to chat, or if you like, you may unmute yourselves. Let's talk about now the drugs used in Parkinson's disease. So, take note, class. Take note of this. These drugs that we will discuss are not really drugs used to treat Parkinson's disease. Dili nimo siya matreat ang Parkinson's class. these drugs will just give temporary relief of the symptoms of the condition. But walay treatment. Walay treatment ha. When you say treatment kasi, naayo ka from Parkinson's disease. Meaning, nabalik imuhang substansya nigra. No. Wala tay drug class that will arrest or reverse the death of the neurons in the substansya nigra. So, if a person has Parkinson's disease, itong mga drugs na ito will just give you or will just give the patient temporary relief from the symptoms. So, I hope that is clear na wala jud tay treatment sa Parkinson's disease. So, our drug of choice for Parkinson's disease is levodopa in combination with carbidopa. So, ang ato ang well-known nga brand in the market of levodopa plus carbidopa is Cinemet. Okay? So, nganong levodopa man? Kasi levodopa class is actually a precursor of dopamine in the brain. Meaning once you take it, once it reached the brain, it will be converted into dopamine. And what will levodopa do? It will help restore the dopaminergic neurotransmission in the neostriatum because there will be synthesis of dopamine. Remember, levodopa will become dopamine inside the brain. And then this will help the surviving neurons of the substantia nigra. Tabangan lang niya nga dili kaayo grabing trabaho because of the deficiency sa dopamine. Ang atong mga cells mga class, once they overexert themselves, masamot sila og gaguba, just like the heart. If you have heart failure, ang ginahimo nato is to slow down the heart, not to make it faster. Kasi the more na magtrabaho na siya, the more maguba. So mo na siya ang tabang ni levodopa. So most of the time sa Parkinson's disease, levodopa will be effective kapag naapay mga surviving neurons at least 20% sa substansya nigra. And levodopa plus carbidopa will be consistently effective for new patients. So for the first 2 years of treatment sa patient, levodopa will really give relief sa symptoms sa Parkinson's disease. Naman na siya. Pero kapag magsobra na siya, we will discuss later what will be the effect of levodopa. Magbaba ang iyahang action kapag more than 2 years na exposure to levodopa treatment. So do not forget, class, that though this is our drug of choice, levodopa is just a relief or temporary relief sa symptoms ng ating Parkinson's disease, and the effect will just last kung present ang drug sa body. Therefore, pag muundang og inom ang patient, wala na'y levodopa inside, mabalik gihapon ang iyahang signs and symptoms of Parkinson's disease. So I hope that is clear. Questions about levodopa? Wala? Sure na gyud. Kasi nabot ta din hingdapita ha. So, mechanism of action of our levodopa. Again, I told you that once you take this, it will be transported to the CNS or the brain or the central nervous system, and then inside, it will be converted to dopamine. So, to help the neostriatum in its work with the muscle movement. So, kailangan si dopamine sa case na. Now, what is the action of carbidopa? So, kapila na ako niya siya na-mention sa inyo ha, na carbidopa is a suicide drug or a suicide substrate. Okay? So, paano siya naging suicide drug? Si levodopa kasi, class, ano siya, we have an enzyme in our body, especially in our blood, that will degrade levodopa. So the name of the enzyme is called dopamine decarboxylase. pag si dopamine decarboxylase magkaroon og interaction with levodopa, it will convert levodopa to dopamine. Even if naa pa siya sa periphery, wala pa siya nakaabot sa brain. So mahimo na siya dopamine dayon. Now pag mahimong dopamine dayon si levodopa class, dili na siya makakross sa blood-brain barrier. So wala na siya effect on Parkinson's disease. Therefore, we give carbidopa because carbidopa is a dopamine decarboxylase inhibitor. So inhibit niya na nga enzyme para levodopa is free and it can really reach the CNS. So take note of the enzyme had dopamine decarboxylase. And take note class, if you just give levodopa, kapag kawalay carbidopa, levodopa will again be decarboxylated to dopamine causing adverse drug reactions. So since naa si dopamine sa other parts of our body outside the CNS, ang mga effect ana ni dopamine will be we have nausea and vomiting. And then, syempre, the dopaminergic action of dopamine sa heart, it will cause cardiac arrhythmias, and it will lower down the blood pressure of the patient, causing hypotension. So, muna ang mga adverse effects ni levodopa kapag dili niya nato siya i-partner with carbidopa. So, si carbidopa is able to inhibit the enzyme because it has an almost similar structure, chemical structure with that of the levodopa. Questions? Wala. Let me just look at the okay. Kasi meeting na sad. Let me remind you about your REC. I cannot forward the studies if I don't have a complete list for the pharmacy papers. I think tatlong paper pa lang yung na-receive ko sa REC or dalawa. I cannot remember it kung duha or tulo. But please, I'm reminding other groups to please email now your requirements sa REC. Okay? Sige, let's talk about the absorption. So pag pharmacist na tapuhon class, please be reminded that levodopa should be taken with an empty stomach. Kasi gina-single out nato ni siya kasi most of our drugs should be taken with food. Kailangan mo kaon ka before ka mo inom og tambal. So mo ni siya ang exception. Levodopa should be taken with an empty stomach, typically 30 minutes before meal. Okay, before ka mukaon, 30 minutes before ka mukaon, anha mag-inom og levodopa. So what is the reason bakit it should be taken with an empty stomach? Kasi protein interferes with the transport of levodopa in the CNS. So especially if ang atuang gikaon is protein-rich food, it will really interfere with the transport of levodopa from our gastrointestinal tract to the CNS. Kasi class, levodopa is taken orally. And then the half-life of levodopa is just 1 to 2 hours. So class, levodopa is a short-acting drug. Mano siya ang ato ang problema since it's short-acting. Pag mawad-an na og levodopa ang patient inside the body, like nakalimot siya og take sa iyahang next dose, magkaroon siya og symptoms, balik ang iyahang symptoms sa Parkinson's disease. And mato kung gingon kagay na class nga after 2 years, from first to second year of using levodopa, it's very effective. But more than that, magkaroon na taog problem with the levodopa. We call it on-off phenomenon, wherein ang action sa levodopa kay mag-diminish siya, tapos na siya on and off. Pag moingon kag on, ang patient is very okay, wala siya symptoms of the Parkinson's disease. Tapos pagka human, before the next dose, since na-diminish ang effect ni levodopa, magkaroon na of off phenomenon wherein wala pa yung next dose, nibalik na ang symptoms sa Parkinson's disease like tremor, like muscle rigidity, mubalik na siya. So, na siya nga, if more than 2 years na, especially mga 5 to 10 years of taking levodopa, the doctor will really monitor the patient for this one kasi i-adjust ang dosage regimen. It's either you increase the dose or the doctor will decrease the interval. So magkapila na siya sa isa ka adlaw mo take of levodopa para lang to avoid the off phenomenon. Pero actually kanang pag mag on and off phenomenon na ang levodopa, pwede siya mahimong sign na the patient is no longer responsive to levodopa treatment. So the doctor may consider changing the drug of the patient. Okay? Questions? Wala. Napakoy ka istorya diri class.
Naami diri ma'am.
Ay, napaday. Kasi nagsige kong istorya natulog na mo. Kunya katulog na mo kay Parkinson's disease gyud ni siya. So let's talk about the adverse effects of levodopa. First, nagid na siya anorexia or nausea and vomiting, especially that levodopa has action sa brain. So it can trigger the chemoreceptor trigger zone or ma-stimulate niya na nga zone na involved sa pagkaroon ng nausea and vomiting. And then aside from that, since levodopa will be converted, some of the levodopa will be converted into dopamine in the periphery. It's outside the central nervous system, meaning magkaroon siya og dopaminergic activity sa heart. So, do not forget ang effect dyan ni dopamine sa heart class, you have there the tachycardia, that's increased heart rate. And then we have ventricular extrasystoles. When we discuss hypertension, we will discuss this systoles class. And then, systoles and diastoles, ang pitik niya. And then we have hypotension. It can really decrease the blood pressure of the person. And then, syempre, since dopamine is a precursor of making the norepinephrine, na siya adrenergic activity. So, mag-cause siya og mydriasis, that's dilation of the pupils. And then, aside from that, dopamine can cause blood dyscrasias. Pag mayroon ganin mo blood dyscrasias gani na siya, it refers to different conditions sa blood. So it includes anemia, it includes leukemia, or it may refer to mga clotting na mga disorders sa blood. Basta anything na involving the blood, that's blood dyscrasias. Pero actually, ang mga doctors, ginagamit ni nila nga term kanang blood dyscrasias kapag they have seen the laboratory results and kailangan pa nila i-confirm kung unsang klase gyud nga condition ang naa ang patient. If they cannot yet give a definite na sakit sa patient or diagnosis, tapos makita lang nila nga na ay something, na ay problem sa blood, mga blood cells, they will call it blood dyscrasias. So pag moinom pud ang patient og levodopa, pag ECBC na siya, there will really be problems with his or her blood cells. And then aside from that, levodopa will cause, please add the word false because it's false positive Coombs test. Okay? Levodopa again can cause false positive Coombs test. Coombs test is used to diagnose hemolytic anemia. So when you say hemolytic anemia class, it's a kind of anemia wherein the red blood cells will hemolyze, maglyze na sila. So anemia gihapon ang iyahang gawas. But again, na-lysis, so we call it hemolytic anemia. And we diagnose hemolytic anemia using the Coombs test. And if nag-levodopa treatment ang patient, pwede siya magkaroon ng positive na Coombs test even though wala siya hemolytic anemia. And then another thing, a patient under levodopa treatment may have brownish saliva and urine. So this is due to the melanin pigment formed because of the catecholamine oxidation. So, di ba, we have dopamine class. It's a kind of catecholamine. So, if it is oxidized in the body, it will lead to the production of melanin. So, it's a brown pigment. It's just not seen sa ato ang skin, but it can be seen in the body, leading to the brownish coloration of the urine and the saliva of the person in levodopa treatment. Questions about the adverse effects? I hope na sabtan to. Bisag daghan sila. Para wala question. Sure na gyud na. Sige. So isa pa lang ni ka-drug ha. Isa pa lang ni ka-drug dugay kay tamang manog discuss. Now let's discuss the interactions of our dopamine. Class, if a person is under dopamine treatment, you have to remember that this should not be given concomitantly with vitamin B6. What's the name of vitamin B6 again? Si pangalan ni vitamin B6, di ba? Vitamin B1 is thiamine, B2 is riboflavin.
Pyridoxine.
Okay, very good. So vitamin B6 is pyridoxine. You don't give this concomitantly with levodopa because vitamin B6 will increase the breakdown of levodopa to dopamine in the periphery. Dili nato na gusto nga wala pa siya kaabot sa brain or sa CNS, nahimo na siya og dopamine. Okay? And then, aside from that, you don't give also levodopa with non-selective MAO inhibitors. Kasi mudaghan kaayo ang dopamine, it will lead to psychosis class for the person. Kasi remember, MAO inhibitor, they will inhibit the enzyme called MAO, monoamine oxidase. Tapos, di ba, enzyme na siya nga nag-degrade og mga catecholamines or dopamine, for example. So, kung gi-inhibit na to ang MAO, mudaghan ang dopamine. Tapos, niinom pa jud ka og levodopa, musamot siya og kadaghan. So, actually, it makes sense. Pwede siya isabay, but a certain condition only, certain level only. Pero pag mo exceed na siya, daghan ng kaayog dopamine ang patient. Mag-psychosis na siya class. Okay? And then we have antipsychotic agents. That's antipsychotic. Please remove S. That's not it's antipsychotic. Antipsychotic agents. Sila, you don't also give this concomitantly with levodopa kasi remember, baliktad silang action. Wait lang. Baliktad, pag moingon magugkag antipsychotic drugs, they will inhibit the action of dopamine. Kasi mo na atong problema sa psychosis. Tapos, ang levodopa, you are giving dopamine to the patient. So, antagonism ang drug interaction ani. Ha? So, wala na siya ginasabay og hatag. And most likely, you don't give levodopa to patients with psychosis. O daghan kaayo ilahang dopamine, how can we treat the psychosis if gitagaan nato sila og dopamine? And class, levodopa should also be used with caution sa cardiac patients. Kasi remember, dopamine has effect sa heart. So, pwede siya mag-increase o heart rate. It can lead to extra systoles and it can lead to hypotension. Mababa ang blood pressure sa patient. Questions, class? Before tayo mag-move to another agent or group of agents, na ginagamit for Parkinson's disease. You want to clarify something? Even kayo nag-chat. Wala na akong kabaloon sa akong unahon. So pag namoy kailangan sa ako, kailangan ko ninyo i-chat permi ha. Kay matabunan gyud ang inyuhang mga message sa ubos. Dughan na kayo sulod ako akong chat box sa Messenger. Okay? Wala. So let's move on. Let's have the monoamine oxidase inhibitor. But before that, let's have a review of our MAO. Again, MAO is located most likely inside the cell. And ang trabaho ana niya kay mag-metabolize or mag-degrade or mag-destroy yung mga catecholamines. Now, we have two types of MAO na enzyme. We have MAO type A, which metabolizes norepinephrine and serotonin. So actually, appeal din ha si epinephrine. So i-add na lang ninyo si serotonin ha kasi monoamine can also metabolize serotonin. Serotonin, remember, is our happy hormone. And then, for Parkinson's disease, actually, ang target nato kay si MAO type B. Kaya mauna siya ang enzyme na nag-metabolize kay dopamine. Okay? So, what are these drugs na nag-inhibit of MAO type B? The first one is called selegiline, also called deprenyl. Remember the mechanism of action? This will inhibit the MAO type B. So, pag wala ang MAO type B, walay mag-degrade og dopamine. So, leading to the increase of dopamine level in the brain. Sama na siya ang mechanism of action ni selegiline. Now, what is our problem with selegiline? This drug inside the body will be converted into amphetamine and methamphetamine. So, this is one of the reason class why, di ba, nakaagi man guro taog drug test, no? Di ba, before ta mag-drug test na ay ginapaan si Ran. Tapos, ang isa ka question dito kay naaba kay tambal na ginainom. Kasi pwede ka mag-positive sa methamphetamine sa kapag na kay ginainom ng mga certain drugs just like selegiline. Nga inside our body, mahimo siya methamphetamine. So, pag i-drug test ka ni class, mo positive yung ka. Okay? Pero it doesn't mean nga addict ka. So, you really have to declare. And i-declare nimo and then i-attest sa imong doktor nga naga-take ka ani nga drug. So, since selegiline can become amphetamine and methamphetamine in the body, it should not be taken in the afternoon. Labi na basta kanang almost gabiin na, no, kasi it will lead to insomnia. Remember, amphetamine and methamphetamine are CNS stimulant. Okay? Please remember that about selegiline. Now, we have rasagiline, another drug, another MAO inhibitor or MAO type B inhibitor, but this time this is an irreversible inhibitor of the MAO type B. And it is more potent. It is 5 times more potent than selegiline. And another advantage of rasagiline kay selegiline is this is not converted to amphetamine and methamphetamine sa sulod sa body. So, bisag i-drug test ka, you will not be positive. Okay? So, questions about our MAO inhibitors. MAO type B ha. MAO type B. Ga-end na sila sa giline. We only have 2, selegiline and rasagiline. Wala. Sure na gyud. So, let's move on. We have another drug. We have the COMT inhibitors. Kaya remember, duha ka buok ato ang enzymes nga naga-destroy og catecholamines. So, human na ta sa MAO. Let's move on sa COMT. So COMT means catechol O-methyltransferase, and we will be talking about the drugs that will inhibit this enzyme. Kasi pag daghan kag COMT, daghan pud ang mag-degrade sa imuhang dopamine. So atoa siyang i-inhibit para mo daghan pud ang atoang dopamine. And then aside from that, kapag ka nag-take ka og levodopa, usahay gina-combine siya with the COMT inhibitor kasi pag naa kay COMT, pag daghan kag COMT, it will metabolize levodopa to 3-O-methyl-dopa. And pag mahimo na siya 3-O-methyl-dopa, it will compete with the levodopa for active transport padulong sa CNS. So usahay gina-combine with levodopa treatment para dili mahimong methyl-dopa si levodopa and wala na competition going to the central nervous system. So kung si MAO inhibitors nag-end sa ghrelin, atong mga COMT inhibitors class nag-end na sila sa capone. Actually, I don't know if I'm reading this correctly, but my teacher would read this as entacapone and tolcapone. Pero kapoy man gud magbutang og ne, so tolcapone, tolcapone and entacapone. So do not forget their mechanism of action ha, inhibition of the enzyme COMT. So ang ang tolcapone sa ilahang duha, tolcapone has longer duration of action but it is more toxic. It can cause fulminating hepatic necrosis, otherwise known as acute liver failure. Mukalit og guba ang liver ani due to tolcapone treatment. So longer yan duration of action pero mas toxic siya sa liver. So do not forget class, duha lang ato ang so far ha, itong mga COMT inhibitors, we have the entacapone and the tolcapone. You will know them sa ending sa ilahang names. Okay? And then we have the dopamine receptor agonist. So kani sila, they will not be converted to dopamine inside the body. Instead, their action is dependent sa ilahang pagbind sa dopamine receptor. So mo ni karon ato ang mga agonist sa dopamine receptor. Pag mo bind sila sa dopamine receptor, they will mimic the action of dopamine. So kanasa nato gamiton si dopamine receptor agonist if kanang ano siya sa tawagan na dili na effective si levodopa sa patient. Like di ba ingon ko naga-on and off phenomenon na. So pwede na ta mag-shift sa dopamine receptor agonist. Pero you cannot use dopamine receptor agonist if from the start walay effect si levodopa kay patient. So dapat may effect sa si levodopa para before ta mo gamit aning dopamine receptor agonist. Now its advantage over levodopa is first, these drugs have longer duration of action compared to levodopa, and at the same time less ang iyahang risk to dyskinesia and motor fluctuations. Kasi si levodopa class, remember the on and off phenomenon, wherein pag nag-off phenomenon na si levodopa, magkaroon na og signs and symptoms ang patient sa ato ang Parkinson's disease. So example sa mga symptoms sa Parkinson's disease, remember the dyskinesia and mga motor fluctuation, ay mga tremor, kadugay mawala na sad, mawala na atong problema with levodopa. So, unsa man ni siya? This is an example of dyskinesia. Pag maingon ka og dyskinesia class, bradykinesia is slow movement ha. Ang dyskinesia, it's abnormal movement. Kanang there is sudden movement that dili makontrol sa patient. So, for example, nag-ani lang ko, pag naay dyskinesia class, mukalit lang na og contract ang mga muscles leading to mga uncontrolled movements. So parehas ani sa iyaha. Remember, our tongue is a muscle. So pag na-dyskinesia ang patient because of his or her levodopa treatment, mukalit lang naggawas iyahang dila and then dili na niya ma-control. ng picture. Gawas iyang dila, niya itulod na lang na niya pasulod kay dili na niya makontrol. Gawas gyud kay naga-contract siya. Questions, class? Unay mo sig patakagwaki din na ha. Kamera magbudyag. Para siya nagawaki, class. Kanang waki good mo pa picture. We call that dyskinesia, uncontrolled movements. Kalito gawas ang bila. Okay? Dili na mabalik. Actually, since dili na nila makontrol, dili na nila mabalik sa sulod, na kanang voluntarily. Kailangan itulod na nila para mabalik sa sulod. So, what are the examples of our dopamine agonist? First, we have the bromocriptine. This is an ergot derivative. I think na-mention ako si ergot sa inyo. Mga alkaloids ni sila nga gikan sa fungus called Claviceps purpurea. Again, ergot derivative ni siya. But ang iyahang action is similar to levodopa. Kasi again, kaya ni bromocriptine mag-bind sa receptor ni dopamine and imimic ang action ni dopamine. Ang problema nato with bromocriptine, since it can also activate the dopamine receptor sa brain, it can cause neurological adverse effects like hallucination, mag-hallucinate ang patient, confusion, delirium. Delirium is a state of confusion gihapon. Kanang mawala sa world ang atong patient. Wala na siya kabalo, di na siya aware sa iyahang surroundings and pero na siya half tulog, half awake. There is confusion na. And then nausea and orthostatic hypotension. This is due to the activation of the dopamine receptors. And then we also have non-ergot dopamine agonist. So mga dopamine agonist gihapon sila but they are not derivative of our alkaloid from the claviceps purpurea. We have two drugs nga ginagamit sila orally, the pramipexole and the rupinerol, mga dopamine agonist. And then we have the apomorphine na ginagamit siya for the management of hypomobility or off phenomenon in advanced Parkinson's disease. So for example, nag-off phenomenon ang person nga na ay Parkinson's disease, meaning na siya mga signs and symptoms. And then, ang isa sa sign niya kay hypomobility, hinay na kayo ang iyahang movement. Ang ginagamit nato to manage that is the apomorphine. And then we have the rotigotine, which is ang iyahang unique na characteristic is ginagamit siya transdermal. So naka-transdermal patch ni ginahatag once a day. And for the whole day, for the whole 24 hours, the patch will give you the drug, the rotigotine, that is a dopamine agonist. So, sa mga actions sa ato mga dopamine agonist, they will alleviate the motor deficit sa ato ang mga patients na wala pa nakatake og levodopa and in patients with advanced Parkinson's disease who are treated with levodopa. So, actually pwede siya if it's a new patient, meaning bago lang siya nagkaroon ng signs and symptoms of the disease, you can actually give the dopamine agonist, basta wala pa nakatake og levodopa. And then para sa mga advanced na, meaning severe na ang case sa Parkinson's disease, na nagkaroon na og treatment with levodopa, niya dili na mo effect si levodopa, you can give the dopamine agonist. So ang atong problema lang, since kaya nila mo activate og dopamine receptors, na sila mga adverse effects both in the periphery like the hypotension or sa heart or sa CNS. We have like hallucination and delirium or confusion. Okay? So, take note of this. Bromocriptine, pramipexole, and darupinerol are effective sa patients with Parkinson's disease complicated by motor fluctuations and dyskinesias. Pag naanay mga ingani ng mga symptoms ang patient, there is dyskinesias. Remember the dyskinesias to mga involuntary nila nga movement. o mga motor fluctuation, mao ni ato ang ginahatag silang tatlo. And si apomorphine is an injectable aside from being a transdermal patch na design, naapod ni siya injectable na dopamine ginagamit for advanced stages sa sakit to supplement the oral medication. Okay? So those are our dopamine agonists. Okay? And then, number 6 na treatment. Wala may question, class? Kaya moderate ko sa amantadine. Humano na lang nako ni tanang treatments for dopamine para tomorrow we will concentrate with Alzheimer's disease, the multiple sclerosis, and the amyotrophic lateral sclerosis. Sige, duha na lang manida. Amantadine, which is a favorite board exam question because amantadine is originally used as an antiviral drug for influenza. Para gini siya sa influenza. However, studying the drug, they found out that amantadine can also increase the release of dopamine, number 1. It can also block the action of acetylcholine. Kasi remember, acetylcholine is responsible for muscular contraction also. And for Parkinson's disease, grabe ang muscular contraction. That is why we need to block acetylcholine sa Parkinson's disease. Mo na nga, included siya dire, blocks cholinergic receptor. And inhibits the NMDA receptor or the N-methyl D-aspartate type of glutamate receptor. So sa Alzheimer's disease, I will be discussing the NMDA receptor. So because of these mechanisms of action, amantadine can also be used as a treatment for Parkinson's disease. But since naa siyang effect sa dopamine, sa acetylcholine, and sa glutamate receptors, naapod siya mga adverse effects, especially sa CNS. And then sa heart also, especially the effect of dopamine sa heart. However, this is less effective compared to levodopa, but the advantage is it has lesser na adverse effects compared to levodopa. And then our last group of drugs for Parkinson's disease are our anti-muscarinic or anti-cholinergic agents. So we have 4, the benztropine, trihexyphenidyl, procyclidine, and the piperidine. If I'm not mistaken, the brand name of piperidine in the market is Akineton. Again, it's Akineton. Brand name, Akineton. Akineton. Na-mention ako kagaina, we need to block acetylcholine sa person with Parkinson's disease because acetylcholine can cause muscular contraction. And for persons with Parkinson's disease, grabe na ilahang muscular contraction class. Kaya remember, naga-tremor sila. So, pwede gamiton si anticholinergic for this case. But these are also only used as an adjuvant treatment, meaning pandagdag lang. Pandagdag lang. Dili sila pwede nga single treatment, maulang ni atong ihatag, pandagdag lang ni sila. So, ang iyahang effect, nato sa pag-inhibit sa cholinergic drug, ay sa acetylcholine, and ang iyahang adverse effect, ang kabaliktaran ni dumbbells. Nakuha? Kay anticholinergic man. So, adverse effect, kabaliktaran ni dumbbells, excess of that, o na siya ato ang adverse effect for anti-muscarinic drugs. So, dira sa tamag-end. Okay? So, again, we are now sa stoichiometry. Do not forget how when you say stoichiometry, you are determining either the element or the compound na nasa iyong balanced equation. You can determine kung pila ang amount na needed or kung sa reactant na siya nga side, pila ang amount na anuhan na needed. Pero kung sa product na side, then pila ang amount na na ma-produce. Wait lang. Sige. Let's continue. So again, stoichiometry, you can determine the amount of your element or compound in a balanced chemical equation. So pwede mong ma-predict kung gaano kadaming compounds or elements ang mapoproduce, or you can also determine the required amount of the reactants. So actually na-startan na nato no ang atong computation na-startan na pud nato. So i-continue nato with another example. So this one, how many grams of nitrogen monoxide is produced if 12 grams of oxygen is combined with excess ammonia? So class, you have here 12 grams of oxygen. So sa ato ang balanced equation, diba, kailangan og 5 moles sa oxygen para ma-produce ang 4 moles ni nitrogen monoxide. But this time, if you have a given nga in grams, 12 grams of oxygen, actually, you can also determine kung unsa pud kadaghan nga nitrogen monoxide ang ma-produce. And you just have to follow the pattern. You'll start with a given 12 grams. And then, yung 12 grams, before mo ma-compute ang amount in grams ng iyong product, you have to convert this into moles first. Now, how do you convert that into moles? You need the molar mass of oxygen. So, ang tandaan ninyo, again, lito na ko ha, kung naa siya sa taas ang grams, dapat ang next na given sa baba kay para ma-cancel. So this 32, asa ni siya gikan? This is the molar mass of your oxygen. So remember, atomic weight ni oxygen 16, but since that is O2, mao na siya nga 32. So ma-cancel ang grams, class, ang mabilin kay moles. Ang next one is kailangan nato mabalaan ang moles ni nitrogen monoxide. So kailangan nato ang mole ratio. So kay moles of oxygen maning naa sa taas, automatic you place the moles of oxygen sa ilalom. Naasa ni gikan, this is the mole ratio. 5 moles here of oxygen will actually yield 4 moles of nitrogen monoxide. So we can cancel ang maiwan moles ni nitrogen monoxide. Pero wala pa ta nahuman kay dili man moles ang ginapangita sa problem. Ang ginapangita man kay grams ni nitrogen monoxide. So, to convert moles to grams, kailangan nato ang molar mass ni nitrogen monoxide. So, nitrogen is 14, oxygen is 16, 14 plus 16, that is 30. So that is why you have here, though wala lang ni siya gi whole number no wanang na decimal places. But anyway, please just follow my instructions. So ma-cancel ang 4 moles ni nitrogen monoxide. Take note ang mabilin grams ni nitrogen monoxide. So kung ingani nga, pwede na nato ma-cancel ang mga units, nakuha na nato ito ang desired na unit, we can now do the math. So 12 times 1 times 4 times 30.01, and then divided by 32 times 5 times 1. So the answer here is 9 grams of nitrogen monoxide. Mani siya ang ma-produce pag naa kay 12 grams ni oxygen. Questions, class? I will summarize the pattern later ha para dili mo maglibog. Sa stoichiometry naman siya pattern. So na siya path actually. We call it stoichiometry path. So pag given ng grams, you have to convert it to moles first, and then you have to convert it to moles of what is asked in the problem using the mole ratio before you can get the grams of what is asked in the problem. O na iyahang pattern. Kaning X, this refers to the given. So na for example, grams ang given, tapos grams po ang ginapangita. So you have to follow the whole pattern. So this is the grams of the given, ang X. And then, i-convert nimo siya sa moles using the molar mass or the molecular weight. And then, i-cancel nato ng X kay Pangitao na to ang moles sa what is asked in the problem. Tapos again, kay moles naman na siya, i-convert na to siya balik sa grams using the molar mass. Maula na siya ang path na ginasunod nato sa stoichiometry. So do not forget ha, nga to convert grams to moles, you need the molar mass of the given. And then to get the moles of Y, you need here sa gitna the mole ratio. So you can see the mole ratio again in the balanced equation. And then, if you have the moles of what is asked in the problem na, you have to convert it into grams if grams ang ginapangita using again the molar mass of Y. So, mao na siya ang atuang pattern. Pero, wait lang, let me summarize this. This is the whole pattern ha. Kaning whole pattern, this is used, i-read na ko ha, if we are if the given is in grams and what is asked in the problem is also in grams. This is the whole pattern. But we can cut this pattern depende sa given. So pag ang given class kay grams sa imuhang substance, and then you are looking for the moles sa imuhang another substance, taman lang ka diri. Taman lang ka sa mole ratio. So, again, kaning naka-blue, gamiton nimo na siya nga pattern if the given is in grams and what is asked in the problem is in moles. So, taman lang ka din ha. So, I hope masundan ha. And then, let me change the color of my pen. Ay, ayaw lang yung black. Wait. Arte-arte. Okay. Now, if the given naman class is in moles, so diri lang ka magsugod. Kaya dili, no need naman to convert. So, moles ka, tapos, ang ginapangita kay grams, so diri ka, hangtod ka sa end. So, moles to grams, ang pattern nimo is ikat nimo, diri lang ka magsugod. So, ang green class hakay, if ang given kay moles, tapos you are asked to compute for the grams. Mana siya ang sa green. And ang last one class is kani, diri sa tunga. If ang given kay moles, tapos you are also looking for the moles, diha lang ka sa tunga. Given ang moles, you just have to multiply it sa mole ratio para makuha ni mo ning moles. So, moles to moles, kana lang sa tunga ang imuhang gamiton nga pattern. So, I hope nakuha. Questions? Questions about this? Wala. Sige, sundan ninyo ng pattern na to, ha? Okay, maulang na ang balik-balik lang yun nga ginagamit nga pattern for stoichiometry. So, convert lang ta. And then, kung gusto na to i-convert ang moles to grams o grams to moles, we only need the molar mass. Kailangan lang din ninyo mag-follow instruction kung pila ka decimal ako ang ginapangayo. Kung moles to moles lang, mole ratio lang pud ang inyuhang kailangan. So it is very important to first balance the equation so that you will use the correct mole ratio. Okay? So tanawan nato be. This same. Ano na lang ni? Recitation. Pasend na lang sa chat. PM. I-private message sa ako sa chat ang inyuhang answer for this one. So, this same nga chemical equation class. Again, this same na chemical equation, we will just compute for the given. So, number one, how many moles of water can be made using 1.6 moles of ammonia. So please, sa chat na lang. Okay, para ma-record na ako dinhi ang inyong answer. Sa chat ha, isend sa chat, i-private message. Again, how many moles of water daw can be made using 1.6 moles of ammonia? This is my
Kasi yung 6 months.
paano ha pa send sa PM? Kaya akong isahon og butang diri sa recitation. 1 minute left. Sige, let us see kung tama ang inyong gisend nga answer sa chat. Let us see kung tama ha. So we will follow the pattern, class. Take note of this. The given is in moles, and then you are also looking for moles. So di ba grams of X, himuon mo siya moles of X, and then convert nato siya sa moles ni what is asked in the problem. We need the mole ratio here sa tunga. And then, convert nato siya into grams of Y. So, to convert grams to moles, you need here the molecular weight. And then, dito din, to convert moles to grams, you also need the molecular weight here. Now, for this problem, moles to moles lang siya. Ingon ko sa inyo, pag moles to moles, you only need the one in the center. So, pag answer ninyo class, you just have to write this one, 1.6 moles of ammonia ang given. Unya, pila daw imong ma-produce na water. So, i-multiply lang nimo ni siya. Take note, moles to moles, you just need the mole ratio. Now, kay moles ni ammonia man ang naa sa taas, dili nimo siya ibutang sa baba para ma-cancel. And then, ang moles ni water ang sa taas. So, gamito na to ang mole ratio based on the balanced equation. So, ang moles ni ammonia, you have there 4. And then, ang maproduce supposedly is 6 moles of water. So, makancel ng moles ni ammonia ang mabilin kay moles ni water. So, let's see. 1.6 times 6 divided by 4. The answer here is 2.4 or 2.40 moles ni water. So let me record it first. I need to record this. Adjust lang. Okay, para di ko makalimot. Okay. Adjust lang. Ha? Hindi ko kalimutan. It's makalimot ko. Bilitsan ako ha. So while waiting, habang gina-record na ko ni siya, let's answer the next one. So letter B, what mass of ammonia is needed to make 0.75 moles of nitrogen monoxide? I'll wait for your answer while I'm recording those na nag-send sa kuha sa chat. Yeah, wait ha.
Decimal lang gamitin, ma'am.
2 decimals, tapos kung naay molar mass, i-whole number. Ang 2 decimal kaysa final answer. Wala, tubig. Wala na? Wala ni tanan? Sige. Sansara na to siya, class. Ilahili ko answer. Ano man ni? Sige. So, unsay given sa problem? The given sa problem is 0.75 moles of nitrogen monoxide ang ma-produce. Pero what is asked? Pila ang needed na mass. So, kung mass class, it should be in grams. Pag mass ha, mass of ammonia. So, kani, this should be moles to grams. Now, sa atuang pattern, if moles ang given, you will start here. So, no need na diri sa grams kasi given na imuhang mole. So, diri ka mag-start. And then, since grams ang ginapangita, going here. So, up to the last part sa ito ang pattern. So let's try answering this. 0.75 moles of NO. Unsay sunod sa atong pattern? The mole ratio para makuha nato ang moles sa ginapangita sa problem. So ang mole ratio nato ani, unsay mole ratio nato? Ayan. So, moles of NO sa baba para ma-cancel. And ang sa taas, syempre, ni moles ni ammonia. So, unsa ang ilahang mole ratio? 4 moles of nitrogen monoxide is produced if you have 4 moles of ammonia. Tapos, we are not yet done. Naanatay moles. Ang sunod na, i-convert nato siya sa grams through or via the molecular weight. Gamiton natin si molecular weight. Now, moles man ni ammonia. So, moles po ni ammonia ang sa baba. And then, grams niya ang sa taas. So, unsa ni siya? Molar mass ni ammonia. How do we get the molar mass of ammonia? Molecular weight lang ni. So, 1, 3. Multiply nato sa ilang mga atomic weights. 14. For nitrogen, and then this is 1, so 3 equals 17. So the molar mass of ammonia is 17 grams in 1 mole. So makancel ang moles ni nitrogen monoxide, moles ni ammonia, and ang mabilin kay grams ni ammonia. So 0.75 times 4 times 17 divided by 4. The answer here, the correct answer here is 12.75 grams of ammonia. So, muna siya, this is 12. 12 grams of ammonia ang needed para ma-produce imuhang 0.75 moles na nitrogen monoxide. Okay? So let me record. While I'm recording, please answer the next question. I hope you can still read it. Again, while I'm recording, you answer the next question. Sorry. Yeah. Listen ako niyo.
Ma'am, ilang decimal yan ni ma'am?
Ha?
Ilang decimal points?
2. I-whole number lang ang ano ha, atomic weight. Okay, wala na? Okay, let's start. Let's see if tama inyong answer. So this one, how many grams of nitrogen monoxide can be made from 47 grams of ammonia? So this one is grams to grams, meaning we need the whole pattern for this. So the given is 47 grams of ammonia. Sa pattern na to, ang next is i-convert nato siya sa mole. So kailangan nato ang molar mass ni ammonia. Pero na-compute na to kagaina, di ba? It's 17. 17. So, diri siya sa baba, class. Kay para ma-cancel. Sa taas ang mole. Now, pag na-convert na nimo siya into moles, ang next step is you need to get the moles of what is asked in the problem using the mole ratio. So, the mole ratio here is sa mole of ammonia, sa baba siya kay para ma-cancel, and then ang moles ni nitrogen monoxide ang sa taas. So, mole ratio na siya, meaning kung unsay makita sa ato ang balanced equation. So 4 moles of ammonia is needed to make 4 moles of nitrogen monoxide. Pero wala pa tanahuman, kay grams man ni nitrogen monoxide ato ang ginapangita. So moles na pod sa baba, grams na ang sa taas. And then, unsa ni siya dire? Para ma-convert siya into grams, we need the molecular weight ni nitrogen monoxide. So that is 14 plus 16, it's 30 grams sa isa ka mole. So, makancel ni kanisad and this one. So, mabilin kay grams ni nitrogen monoxide. So, 47 times 4 times 30, okay, divided by 17 times 4. The answer is 82.94 grams of nitrogen monoxide. So, mauna siya kadaghan nga grams ni nitrogen monoxide ang ma-produce pag naa kay 47 grams of ammonia. Okay? Sige. So, while I'm recording this, please answer. That's the last one, I think. Yeah, it's the last one. Sige, record sa, copy na lang sa, kaya mag-record ko. Ano ka ding mga wala naka-report mo katong mga absent kay wala mo i-record diri sa kuha kay absent mo tong time nga nag-reporting inyong grupo. So ano ka gyud mo ron ug bawi ani. Sige. So questions class about stoichiometry. Wala, kaya lang. Isod. Sige, I hope kaya lang ha. So your activity number 7 is still sa stoichiometry ha. Katong 5 and 6 manggod will just serve as introduction. Practice sa to mag-convert og moles to grams, grams to moles, and atoms. Practice sa to siya. Karon, we will apply those things sa reaction stoichiometry. Actually, mahaba lang ni iyahang introduction. But the introduction is di-discuss na nako using my slide. So, katong pattern, sundon lang to ninyo. Isa-isa lang ninyo ang pattern dinhi sa introduction. So, you may read this one or you may review our discussion sa katong slide na akong gigamit. I-send naman ako ang recording sa first. I-send lang po na ako ang recording sa kaning karon. And then, I have also discussed the mole ratio, right? Dito sa lecture na ko using my PowerPoint. So, yung ana lang gihapon, examples gihapon ang naa sa introduction for this. Now, ang inyong hadyong answeran naa sa dire. So, laboratory activity, reaction stoichiometry, and ideal stoichiometry calculations. So you have to write the objectives and then you have to answer the following problems. So dinhi sa first part, write all possible mole ratios. Unsa ginamit ani? Tanang posible nga mole ratios inyuhang isulat dinhi. So for example, mao ang answer na kay inyo ng activity. So, ato ang himuon, atong gamiton katong sa example sa akong slide. This one. So, ito. 6 oxygen or 5 oxygen. Wait, let me see it again. 5 oxygen there. 5 oxygen and then 6 moles of water plus 4 moles of nitrogen monoxide. Pag ipalista gani sa inyo ang tanan possible na mole ratio class, ang meaning ana, for example, na kay 4 moles ni ammonia, mag-react siya with 5 moles of oxygen. That's the first possible na mole ratio. Another possible mole ratio, si 4 moles of ammonia will lead to the production of 6 moles of water. That's another possible mole ratio. Another possible mole ratio, ang upat ka moles ni ammonia will also produce 4 moles of nitrogen monoxide. Yan. I-list down ninyo tanang possible mole ratio. And then, kung naapa may makita, then sulat ninyo dire. So, ang 5 moles ni oxygen will produce 6 moles of water. So, ana. And then, pwede po, 5 moles of oxygen will produce 4 moles of nitrogen monoxide. And then, diri na lang ang number 6. Si 6 moles ni water will be produced in this reaction and then makaproduce po og 4 moles of nitrogen monoxide. So, mani ang mga amo ni tanan ang mga possible na mga mole ratios. Now, sa first part sa inyong activity, you just have to identify all possible mole ratios in the given na mga equation. But you have to check if they are correctly balanced. Okay? Question sa first part sa activity.
Wala,
Wala?
ma'am.
Sige. So sa second part of the activity is you have to analyze and solve the problem. And then you have to show your solution. So sa number 1, for example, ammonia is widely used as fertilizer and in many household cleaners. So how many moles of ammonia are produced when 6 moles of hydrogen gas react with an excess of nitrogen gas? So, i-analyze ninyo ang problem class, tapos magbuhat mo og equation based dito sa problem. Kung unsa ang reactant, and then unsa ang possible na mga products. Tapos, pag nahimo ninyo ng equation, you have to make it, at you have to ensure na i-balance ninyo siya. Pag na-balance na ninyo siya, you can proceed with the stoichiometric calculations using the pattern I gave you. So, ana ang pag-answer sa second part sa activity. That's the same thing sa question number 2. The decomposition of potassium chlorate is used as a source of oxygen in the laboratory. So, how many moles daw of potassium chlorate are needed to produce 15 moles of oxygen? So, please identify unsa ang reactant ani nga problem, unsa ang products, and then you balance the equation, and then once ma-balance again, you may proceed sa stoichiometric calculations using the pattern I gave you. So, mauna ang inyuhang activity. I still have 30 minutes na remaining na time. Kamu na bahala kung unsaon ninyo pag-utilize ang remaining na 30 minutes.